right. The very good question. The surgery of knee replacement is now pretty safe, and in fact, it is one of the safest and most successful operation in orthopedic surgery, with a track record of more than 40-50 years and success rate of more than 95%, with longevity of 20 to 30 years. So there is no doubt that knee replacement in properly indicated patient, well done by experienced surgeon in good center, gives you outstanding result. But it is reserved for end stage arthritis. Arthritis is divided into four stages, 1 to 4, 1 being the least and the fourth is the most affected joint. So it is usually indicated in stage 4 arthritis, where there is direct bone to bone contact and all the cushioning cartilage of the knee joint is worn out. This can easily be assessed on a standing x-ray of the knee joint. And if patient has continuous problem, patient has deformity, unable to walk properly, instead of taking painkillers, etc., it is better to go for knee replacement, because not only it will relieve the pain, but it improves the quality of life tremendously. And if somebody has to live for 10, 20, 30 years more, nowadays life expectancy is pretty good. Most people go up to 70, 75 or 80. So if someone has knee pain due to severe arthritis at the age of 55, 60, instead of pulling on with painkillers, etc., for next 10, 20 years, it is better to go for knee replacement, so that you can avoid complications related to chronic use of painkillers, as I mentioned before.